make a lot of assumptions about what people think health information is, and then try to put our assumptions on their worldview. And I think that's one of the big challenges associated with health information in general, is we don't even know what people consider as health information, which is why it's great that we're starting the conversation this way. And then we don't know how, like, what information is relevant to them, why do they care, and how do we use it to help them do the right thing for themselves.
Where do you get health information to answer your questions?
For the clínica de Cardoso.
I guess at the hospital or a clinic, or
Yeah.
But besides news sources that I find credible, my doctor.
Well, when I have a health question, I usually wait until I see my primary care physician and I ask her questions. Or sometimes I go online and I just Google it.
Gmail. Okay.
Google it.
I have WhatsApp.
WhatsApp. Got you. Okay.
Me personally, I actually go to the internet.
I don't need to download an app that pertains to health, because there's so many other things pertaining to health that you can just go right to
Like
and
what?
see anything you want to see.
Like what?
Like Google.
Oh, okay.
I don't download anything on my phone because I don't trust nobody.
When we talk about health information, particularly on the individual level, it's far too narrow, because if you ask people where they get health information, just on the surface, a lot of times they'll say, I get health information from Google, or I'll ask my doctor. But there's so many other ways we're consuming health information and not thinking about it.
And so, other than your doctor, where else do you think you can get trusted health information?
Sometimes from a elder, or
What does
like
that mean?
like an older person that been through like similarities.
Oh, right. That's what I call the grapevine.
This is the whole basis of Grapevine Health, because it's a bit taboo to say you get your health information on the grapevine. And the study we did to launch Grapevine was actually talking to people who are sitting in the emergency department waiting room. They're there because they've Googled their symptoms and they're freaked out. So then what do you do if you don't get the answer from Google? That's when you get the information. And I think a lot of this information is just so naturally transmitted. This is where people pick up their knowledge. And so if you can find ways to be in those conversations and in those spaces as you're creating, I think that could really help.
I don't think there's ever going to be a one size fits all. We saw that a lot of people did have smartphones, but we heard mention of like television from several people as a source of information. But people, really trust their physician. They talked about family members as sources. And so I think within healthcare, a lot of times we can think about, if we just, design this great website or this app, everyone's going to come to this one place where we want everyone to go. But I think the thing we really have to keep in mind as we're thinking through digital opportunities and how this impacts how we design products for different organizations, that it's really never going to be a one size fits all. And we really have to have multiple channels for people to access information and then access the services that we provide within healthcare.
You get information on Facebook.
Yeah.
Do you trust it?
Yeah.
You believe the information you're getting from the television?
Yeah.
Okay.
Everything I information me in the TV.
Let's see, the Washington Post, the medical experts on CNN. Anything outside of those venues, I go back to verify my more trusted sources before I trust them.
And how do you decide if you can trust it or not?
I don't, because I actually don't trust anything.
There's just so much information everywhere that people can get access to, and it can be incredibly overwhelming. And if people are like set in their ways and they have these few avenues that they trust, it's on us, when we're designing products, to try to figure out ways to break through that trust and to make it less overwhelming.
It's a really interesting opportunity for digital to potentially separate the difference between trust and truth, within the context of these, within the context of the grapevine, right? Like the grapevine, as well as Facebook and Google, like there's tons of misinformation out there. But if there was a way for us to differentiate between you trust this versus it's the truth, and like some social networks are starting to try to do that, but I think that technology may potentially have like almost like a really strong opportunity for like a verified source kind of thing, even in the context of like verified but personalized.
Well, I love that, and I'm so glad you raised that, because when I ask people, well, how do you know you can trust it? People don't have the words to explain that. It's a visceral, it's in their gut. I mean, it's the same for all of us. Like instinctively, we decide, that doesn't really pass the laugh test, or that sounds really credible. But the problem is, someone can sound very authoritative about something, and people will decide, wow, okay, he must know what he's talking about. So I love this notion that we could explore how to differentiate those two.
We push a lot of information out to people, but there's not really a way for anyone to verify their specific scenarios. We have things like our chatbots that allow people to assess, their symptoms, but they're very generic at this point, and you have to fit kind of a very like cookie cutter experience for that information to be applicable to you. And so one of the things that I think is interesting to think about digital, and maybe some of the opportunities we have from an AI perspective as well, is how we continue to evolve some of those technologies to support I think getting to the personalized experience again, to address some of the more specific situations for people to be able to test either their scenario or ask questions about, things that they have heard through the grapevine about how they should even treat specific circumstances. I think what's really important when we think about that sources of connection too is enabling people to find either physicians or other people like them in the community in ways that maybe we haven't today from a digital perspective. So I think a lot of times when we go on to like a provider directory, you can search by, the specialty or the location. And a lot of times I think that's it. But, as we've enabled more like reviews of providers online, and providing more information maybe about who the provider is and what they focus on, I think it starts to open up some doors for us to think about the provider kind of search process a little more holistically.
You don't meet someone on Match.com and get married. You meet them, and then you have some, like back and forth, and you get to know each other. And it's kind of like, why don't we do try before you buy for primary care providers? Like, you don't have to wed yourself to a given doctor without ever having met them. Digital, especially if we were to layer on like telehealth or other kinds of remote ways of communicating with a provider, could really enhance that ability to establish a trusted relationship before you fully commit.
Yeah, it's like it's just lunch of healthcare.
Yeah, totally.
I think everyone can be an expert when it comes to health information. It's because it can be very individualized. Health information is transmitted just organically in the community from person to person. When we say listen to community, it's not listening to the people who serve the community, it's actually listening to people like that.
I think it is really about including the community in the design of those. And so thinking about how we include a broader and more diverse set of people within our design and develop processes for products, I think is a really important aspect of it that I want to make sure we don't miss.
I think we always need to be reminded and actively work to see perspective outside of ourselves. So don't make assumptions about what people think health information is, or what kind of health information works for them, or what kind of delivery modalities work for them. We talk a lot about like closing the digital divide, but we're still in the very nascent stages of what that means. And so I think these are important kind of principles to take back to that kind of thinking.